When locating parts of the body or injuries or scars, other spots on the body, it's very important that you use exact, precise language. After all, language is the way that we communicate with each other, and communication in a clinical health setting is very, very important. Imagine you were stabbed on the street and brought in by the paramedic. You really want the paramedic to be able to explain to your doctor where the stab wound is. You certainly don't want the doctor to waste time looking for it while you're bleeding out. There's a lot of terminology in this video, so I've broken it down into different sections. We'll talk about landmarks first, then anatomical directions, sections, and cavities. All of these types of terms are used to describe where things are located on the body. This is a list of the precise technical terms used to identify various landmarks on the body. I'm not going to go over what each and every term means because there are tons of figures and exercises in your textbook and your lab manual to address that. But they're generally broken down into the head and regions on the head, the neck, the trunk and regions on the trunk. That's the central portion of your body, the part of your body that your limbs are attached to. The upper limbs, your arms and regions there, and the lower limbs and arms and lower limbs are legs and regions there. Understanding these landmark terms and using them as much as you can and becoming very familiar with them will really help you out when we start talking about the different muscles and the different bones. Oftentimes there are clues in the names of a structure, in the name of a muscle, in the name of a bone, in the name of a blood vessel, in the name of a nerve. And these clues, if you are familiar with the landmark terms, they'll tell you exactly where to look for that structure. So, start practicing them, use them consistently. That's the best way to fix them in your memory. Now we can discuss the abdominal region of the trunk or the pelvic region of the trunk, but that's a pretty big area. So when you're locating wounds or pain on the abdomen or the abdominopelvic regions, they can be located according to either a set of 9 regions or a set of 4 quadrants. The quadrants are pretty self-explanatory. You always use the patient's left and right, so the right upper quadrant is on the patient's right, left upper quadrant, right lower quadrant, and left lower quadrant. And then for the 9 regions, the central region is the umbilical region, so you can imagine that that's around your belly button, otherwise known as the umbilicus. Then above that you have the epigastric region, right hypochondriac. Hypochondriac basically means under the cartilage of the ribs. The prefix chondro means cartilage, and you have this cartilage portion that connects your ribs to your sternum. So you have the right hypo means below, right hypochondriac region, and left hypochondriac region. Now the lumbar region is the lower back, so you have the right lumbar region kind of in the center of the abdomen, and the left, but off to one side, and you have the left lumbar region off to the other side. Below the umbilical region you have the hypogastric region. Gastric refers to the stomach, so it's the region below the stomach. And then you have the right iliac region. Iliac refers to one of the parts of the pelvic bone. So the right iliac region and the left iliac region. Now we'll talk about directions. When you're talking about relative locations to the right or to the left, above or below, directions may seem to be different depending on the position that a patient is in. For example, lift your arm over your head now. We're going to talk about the terms superior and inferior. Superior just means above, higher than. Inferior means below or lower. So with your arm over your head, your hand is superior to your elbow, right? But put your hand down now, like this guy has. Now your hand is inferior to your elbow. So which one is correct? I hope this shows you how it can be confusing if you don't have a standard position to refer to. Anatomical directions are always given with reference to the anatomical position, and that's what you're seeing here, the anatomical position. Hands down, palms facing forward, looking forward, slightly raised on your toes, with your feet just slightly raised up. So, given that this is the standard anatomic position, and directions should always be given with reference to this anatomic position, the correct term to use when describing where your hand is relative to your elbow is inferior. The hand is below the elbow. You may sometimes hear about a patient being in a supine or a prone position. The supine position just means that a patient is lying down, face up. Prone position just means that a patient is lying down, but face down. There are three main axes of the body that you can use to describe where something is anatomically. We've already talked a little bit about superior and inferior. This is basically your vertical axis. In the upward direction is superior, in the downward direction is inferior. It's not meant to be a value judgment to say that something is superior or inferior if you're talking about its anatomical location. It just means above or below. Your sort of forward-backward axis is anterior and posterior. Anterior is forward, posterior is backward. So anterior is basically in the direction of movement. If you're, doing general forward movement, you're moving in the anterior direction. And posterior is the opposite of that. Anterior is also sometimes described as the ventral direction, and posterior as the dorsal direction. Ventral means towards the stomach, dorsal means towards the back, like the dorsal fin of the shark. In humans and in Elmos, posterior and dorsal mean the same thing, and anterior and ventral mean the same thing. But that's because humans and Elmos walk on two legs. These are actually different axes in four-legged animals. In four-legged animals, anterior is the direction of movement, and posterior is away from the direction of movement. But because four-legged animals walk on all legs, the ventral direction towards the stomach is actually a downward direction, and dorsal towards the back is an upward direction. So the dorsal fin on the shark is not the posterior fin. Our third axis, the horizontal axis, is right and left. We're all familiar with right and left. Just make sure that you remember that this axis is always given from the patient's point of view. So I have this labeled according to Elmo's right and Elmo's left. You can also use direction terms to describe the relative location along a limb, and you'll hear these all the time. Proximal and distal. When you hear distal, think distance. And if you're distant from something, you're far from it, right? When you hear proximal, think proximity. And if you're in proximity to something, you're close to it, right? So when you're talking about directions along a limb, you're usually giving those directions with reference to the point of attachment. So if you're talking about directions along the arm, you're talking about relative to the shoulder. So something that's proximal means more towards the shoulder. Something that's distal means further away from the shoulder. So you could say the hand is distal to the elbow. If you're talking about the leg, the point of reference would be the hip. So the foot is distal to the knee. There are also direction terms that are used to describe the location relative to the midline of the body. So by midline, I mean basically where your spine runs. Imagine an imaginary line drawn along your spine, kind of cutting your body into right and left. Medial, something that is medial, is towards the midline of the body, so it's more middle. So when you see medial, think middle. Something that's more lateral means means away from the midline of the body, on the outer side of. So you might say like your eyes are lateral to your nose, or your nose is medial to your eyes. You can also use the term intermediate. Intermediate just means between a more medial and a more lateral structure. Like your right eye is intermediate to your right ear and your nose. To understand this last set of direction terms, we need to think three-dimensionally, and this is kind of the inside-outside outside direction. And if you're talking about a structure that's more internal, you use the term deep. If you're talking about a structure that's more external, you use the term superficial. So everything that's more internal here is deep to the most superficial organ of the body, which is, of course, your skin. A lot of times in anatomy and physiology and in clinical settings, you'll be looking at sections or slices of an organism or an organ. Sometimes these will be actual sections, like you might be putting them under a microscope. Sometimes they'll be virtual sections, like if you're looking at an MRI or a CAT scan. It's important to understand what section you're looking at in order to understand what you're seeing. There are three kind of planes that you can take sections in that are all perpendicular to each other. If you take a section that divides an organism into left and right, you're taking a section in the sagittal plane. So what it's showing you right here is called a mid-sagittal plane, and mid-sagittal plane is actually a sagittal plane that runs straight through the midline of the body. But you could also have sagittal planes that are more to one side or the other. If you take a slice or sections that the organism is divided into anterior and posterior, that's a frontal section. So that's this plane there. And if you imagined a pane of glass drop down on your head, it's a horrible image, but drop down on your head, dividing you in half. If it divided you into an anterior half and a posterior half, that's a frontal plane. Also called a coronal plane. So coronal and frontal mean the same type of section. Now, if you take that same pane of glass and cut yourself in half so that you are divided into a superior and an inferior half, that's called a transverse section, sometimes also called a cross section. A section that's not strictly horizontal or vertical is called an oblique section and can be very confusing to look at because organs that you may be used to looking at in a particular way will look weirdly elongated. They might look like they're out of place. An oblique section in this image would look something like that. Because structures within the section tend to look kind of odd on oblique sections, it's best to avoid them if you're really trying to identify structures. Here I'm just showing you an example of how the human body can look very different depending on what type of section you're looking at. This is an example of an MRI from a 72-year-old male housed at the Visible Human Project at the National Library of Medicine. You can go ahead and play around a bit on their website here. if you like. We are looking at a sagittal view, so this is looking at the head and torso. The legs dropped off because this is a mid-sagittal view, so the leg actually isn't present. You can see the lungs there, you can see the brain there, you can see the rib cage, spine. This is a frontal or a coronal view. Because it is a coronal view, you can actually see the limbs, both legs and both, at least upper arms are in the section. You can see what the brain looks like. You can see both lungs in that view. If you're looking at the transverse view, the axial view, you're looking at basically a cross section. Here, this is your lungs. This is your heart. This is the man's heart. These are the arms. You can see that these structures look very different, and if you didn't know what the different views look like and what view you're looking at, you might become a bit confused. A lot of times you'll be looking at sections of organs that are longer than they are wide, so roughly cylindrical organs. Think about a blood vessel, or your intestines, or your trachea, your windpipe. When you're looking at an organ of this type, you'll encounter these terms: longitudinal section and cross-section, or transverse section. A longitudinal section is a section that's taken parallel to the long axis of an organ. So if I took a narrow slice of this blood vessel like that, what you would see, you wouldn't see the back, you wouldn't see the front, because you'd be taking just a very narrow slice. So what you would actually see would look kind of like this, with the empty space, because this is a hollow tube. You'd see the empty space inside, and then you'd see the tissue that makes the wall of that blood vessel on either side. If you take a transverse section or a cross section, you take a thin slice out of the organ that is perpendicular to the long axis. What you see when you look under the microscope actually looks something like this. So you see, it's like you're holding up a tube from a paper towel to your eye. You can see the hollow space in the middle, and you can see the surrounding tissue that makes up the wall of the blood vessel. So the space in here, this hollow space, corresponds to the hollow space that is in between the two walls in the longitudinal section. Same organ, but different sections give you a slightly different view of it. Okay, deep breath. One more section to go through, and that's talking about the body cavities. The organs in your head and trunk are located within kind of hollow spaces in your body cavities. You have two main divisions of the body cavities. You have the dorsal body cavity, which includes your cranial cavity and your vertebral canal. Cranial cavity houses your brain, vertebral canal houses your spinal cord and runs through the vertebrae. The ventral body cavity gets a little bit more complex. In the ventral body cavity, remember ventral means towards the stomach, so this is the more anterior set of cavities. This includes the thoracic cavity and the abdominopelvic cavities, sometimes separated into the abdominal cavity and the pelvic cavity, but there's nothing really separating the two, so it's oftentimes referred to collectively as the abdominopelvic cavity. The abdominopelvic cavity is separated from the thoracic cavity by this flat-ish muscle, the diaphragm, which is a really important muscle for breathing, and we'll just sketch it in there. That's where the diaphragm is located. In the thoracic cavity, you have the right and left pleural cavities where your lungs sit, your right lung and your left lung. You have the mediastinum, which is the central portion And then you have the pericardial cavity in the mediastinum, and that's where your heart sits. Organs within the ventral cavity are lined by serous, no, it's not a typo, it's serous membranes. We'll talk more about membranes a bit later when we talk about the tissues, but what I mainly want you to know about serous membranes right now is their general structure, and just keep in mind that they are one type of membrane. There are others that we will talk about. Serous membranes are membranes that line organs of the ventral body cavity, and they have this two-layered structure. And to kind of picture it, imagine sticking your fist into a balloon. If you were able to push your fist into the balloon like that, you'd have two layers of balloon around your fist, right? You'd have the inner balloon wall that's actually touching your fist. You'd have a little bit of air, and then you'd have the outer balloon wall that's not actually in direct contact with your fist, but it's connected to that inner wall. So if you imagine, say, your heart as your fist, there's an inner serous layer lining your heart, and that's called the visceral serosa. If you think visceral refers to the organs, so the visceral serosa is the layer that's actually touching the organ. And then the outer layer is called the parietal serosa. When you think parietal, think like a wall. So this is the layer of the serosa that's attached to the surrounding wall of the cavity. And in between these two, you have a lubricating fluid called serous fluid. Acts like a lubricant, surrounds organs like your heart and lungs and your intestines, so that these organs can move in basically a frictionless environment. The serous fluid really keeps these organs, allowing them to expand and contract or to shift around a bit without generating friction and generating heat that might be damaging or that might require extra energy for movement. The three main serous membranes have particular names. The serous membrane around the heart is referred to as the pericardium. So para means around, cardium refers to the heart, so it's around the heart. Around the lungs, that serous membrane is the pleura, and there's a right and a left. And then around the abdomen, it's around the organs in the abdomen, the serous membrane is called the peritoneum. There's a lot of terminology in this video, but don't get scared. Just practice, 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 practice. You'll be using these terms all throughout A&P, and the more you use them, the easier it'll be to remember. If you want to check your understanding right now, go ahead and work through these recap questions.